Patients sometimes ask me why their scans have to be repeated. The modern methodology for monitoring prostate cancer historically was putting needles into the prostate on a regular basis. We didn't have scans that were accurate enough to monitor people. But now with new imaging techniques such as multiparametric MRI, we can actually see the small cancers within the gland, and that can of course be monitored over time. So the scans not only have the ability to see the cancers, but they can determine if there's a change or if they're growing over time, how much they're growing, and over what period of time that they grow. And this is the new basis for our determination as to whether someone has a cancer that's safe enough to continue to be watched, or rather is something that is growing too quickly and needs some sort of definitive treatment. So different situations arise when people consider prostate scanning on a sequential basis. The typical scenario, if someone has a favorable scan and wants to keep track of what's going on, would be to get a checkup on an annual basis. There are situations that arise, however, where small abnormalities are seen. They may be ambiguous. We're not quite sure if they're actionable spots or whether we should be worried about them. And in that scenario, we will consider repeating the scan again after only 6 months. We also consider other alternative forms of imaging, such as color Doppler ultrasound, in addition to multiparametric MRI imaging, to try and determine if a small abnormality looks like it could be worrisome or not.